Thank you for attending this webinar for the BC Infant Stool Color Card Screening Program for identification of biliary atresia. It will take about 12 minutes of your time. The leads for this program are Dr. Rick Schreiber from BC Children's Hospital and Julie McFarlane, the manager of the Newborn and Genetic Screening Programs at Perinatal Services BC. Our hope is that by the end of this presentation, you'll be able to understand the impact of biliary atresia on the newborn, be able to explain the new BC Infant Stool Color Card Screening Program to parents, and distinguish what the role of the frontline nurse and the unit clerk is for educating families about BA. The Biliary Atresia Screening Program is a new program in BC. This program is home-based and is the responsibility of the parents. It fits the criteria for a screening program based on the WHO 10 General Principles for Screening Tests. The decision to make this a screening program in BC was a decision made at the Perinatal Services Oversight Council, where representatives from all the health authorities sit. The implementation began in August 2013 with Vancouver Coastal, Fraser Health, and BC Women's. These three areas comprise approximately 60% of the births in BC. Biliary atresia is a life-threatening disorder in children. It is the most common reason for liver transplants and death from complications of liver failure. Good outcomes depend on early identification, referral, and timely surgical treatment. This slide is a review of the anatomy of the liver in the biliary tree. The common bile duct connects the liver to the intestine. You can see where the bile duct is located. As a side note, the conjugated bilirubin that remains in the large intestine gives stool its brown color. In biliary atresia, the bile duct is obliterated, so no bile can flow into the small intestine, thereby producing pale stools. The condition manifests in the first 2 weeks of life. BA is reported in all racial groups, but is seen most commonly in East Asian countries. In Taiwan, the statistic is 1 in 5,000 versus in Canada where it is 1 in 19,000. The clinical features of BA are jaundice and stool that is pale yellow, chalk white, or clay color. Approximately 66% of the newborns will have neonatal jaundice. The jaundice of BA is frequently overlooked. Jaundice occurring later is often referred to as breast milk jaundice. It is speculated that substances in breast milk may block the proteins in the liver responsible for breaking down bilirubin. This is the unconjugated type of bilirubin. Before reaching the liver, bilirubin is unconjugated. In the liver, it combines with certain sugars to create a water-soluble form that is conjugated. It's the conjugated bilirubin that diagnoses BA. The result will be over 20% of the total bilirubin reported. The conjugated bilirubin passes out of the liver and into the colon, where it is converted back into the unconjugated form, en route to being excreted from the body. In BA, the conjugated bilirubin cannot pass out of the liver due to the blockage in the biliary duct. Stool is a huge concern for parents. How many times, color, consistency, etc. A large percentage of calls to the 811 line are about stool. But there is a lack of awareness in Canada and elsewhere among parents and healthcare providers for the need to look at stool color as a disease indicator. Yet the presence of clay-colored stools has a greater than 95% sensitivity for the diagnosis of BA. Listed here are some of the reasons why there is a delay in the diagnosis of BA in the newborn. It is a rare condition, so most healthcare providers may never see a case. In BC, the statistics are a bit higher than the rest of Canada, with ours being 1 in 10,000 births. There are approximately 40,000 births in BC, so that's 4 to 5 cases a year. As I mentioned earlier, neonatal jaundice is very common in newborns, and prolonged jaundice is often confused with breast milk jaundice. The last reason is related to when parents take their babies for healthcare visits. Most see their healthcare provider before 2 weeks, then don't go again until the baby is about 8 weeks old. This means there is a missed window of opportunity for early diagnosis and treatment. We know that the best outcomes occur when the newborn is treated before 45 days of age. The treatment for biliary atresia is a surgical intervention called the Kasai procedure. The Kasai procedure is the operation done to correct the biliary blockage. The bile duct is removed and replaced with a segment of the small intestine. The bilirubin is then allowed to flow from the liver directly into the small intestine, and the child may not need a liver transplant for many years. Success is achieved if the jaundice clears and the stools become colored. If the Kasai procedure is unsuccessful, then the newborn would need a liver transplant. Liver A is from a child who did not have the Kasai procedure done, and liver B is from a child that had an unsuccessful Kasai. Unfortunately, all children with biliary atresia who are not treated will die by the age of 2. It is for this reason that identifying these newborns early is essential. This slide shows 2 children who had the Kasai procedure. Case 1 had the Kasai at day 43 and is a healthy 6-month-old. Case 2 was identified late and had a Kasai at day 98. The procedure was not successful, and this little one required a liver transplant. As you can see on the last slide, early detection is the key to success. This slide demonstrates what is happening currently with detection. You can see that the majority of the cases are being detected too late for a successful Kasai procedure. 72% are being picked up between 4 and 14 weeks of age. The green curve shows how we need to shift the diagnosis to before 4 weeks. So that's some of the background on the disease. What can we do to improve early detection? Before deciding to implement this program in BC, a pilot study was done at BC Women's Hospital, University Hospital in northern BC in Prince George, and St. Mary's Hospital in Montreal. There were 9,000 families enrolled across all the sites, and 6,187 families who participated at BC Women's alone. There was a 90% utilization of the stool color card by the parents, so they were definitely engaged in doing it. It is a cost-effective program, and it is home-based and family-centered program that the parents can do themselves. So what is the role of the nurse in this program? We want every family with a newborn to receive the BC Infant Stool Color Card at discharge. We want to be sure they know the card is in their discharge package and they know how to use it. It needs to be shown to the parents before they leave, and a bit about why we are asking them to check their baby's stool color. We have provided a laminated nurse script with a copy of the stool color card on the back. You can use this as a teaching tool. Please also sign the newborn clinical path that you have explained it to the parents. It's important that the parents of newborns in the NICU also be educated, as their child may go home before 30 days of age, so they will need to start it then. Here's what the nurse script looks like. It has the stool color card on the back. The nurse script has 8 areas for discussion. The stool color card is a great tool to help teach the parents about normal and abnormal stool color. Begin by showing the card to the parents, either the one on the back of the script or the one in their discharge package, but ensure that they know that it is in their package. Give them an overview of what biliary atresia is and that it is a rare condition. Explain to them that the normal stool colors are at the bottom and the abnormal ones are at the top. Tell them to compare their baby's stool to the card every day for the first 30 days of life. Biliary atresia will show up during that time. They can throw the card away after the 30 days. If they think that the stool matches any of the 3 colors on the top, they are to promptly either call or email using the contact information on the stool color card. Dr. Schreiber from BC Children's Hospital will be in touch with them within a couple of days. He personally responds to all families' inquiries. If he feels it is needed, he will organize further testing in their local community, and if there is a concern that the baby has BA, he will organize an appointment at BC Children's Hospital. The infant stool color card has been added to the newborn clinical path under Education. If you still have the older version, it will not be there yet. You should discuss with your team how the card will get into the package, the discharge package on your unit. It may be the unit clerk on the unit who pulls together the packages, or it could be someone else. You will also want to ensure the person who orders forms is aware of how to order the stool cards. All the ordering information is on the PSBC website. This is a screenshot of the Biliary Atresia page. It can be found under the tab Screening Programs. There will be a drop-down that you can select from. Once on the page, you will see where the translated versions are accessible. We also recommend that if you give a translated version, you give the English version as well. We are concerned that the color printers may be different, so the stool colors may not be as accurate on the copies. The ordering information is on the bottom right. In review, here are some of the teaching aids that we can provide you with: the stool cards and the nurse script, small and large posters that can be used in teaching rooms or in patient rooms. There is also a QR code on the cards where parents can register for a weekly reminder using their smartphone to check their newborn stool. The last thing are the 11 translations that are available. That's the end of the presentation for the BC Infant Stool Color Card Screening Program. If you have any questions, you can contact either Julie McFarlane or Janet Walker at Perinatal Services, and we will be happy to answer your questions. Remember that this is one program that can save the life of a newborn, and it simply involves educating the parents to look at their baby stool color for 30 days.